Welcome to The Blend, a new podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. The Blend takes a deep dive into the expanding role of integrative dermatology, an approach to skin health that blends conventional medical dermatology with complementary therapies to address symptoms and underlying disease factors. In this four-part episode, Dr. Sonal Choudhary, a dermatopathologist, dermatologist, and director of the Integrative Dermatology and Skincare Clinic at the University of Pittsburgh Medical Center, and Natalie Gardinier, MPAS PAC, a Dermatology Physician Assistant at the University of Pittsburgh Medical Center Dermatology, take a deep dive into integrative approaches to treating acne. In part 2 of this four-part episode on integrative approaches to acne, Dr. Choudhary and Natalie Gardinier discussed oral treatments, probiotics, and the importance of sunscreen. Part 3 takes a look at nutritional supplements that can be used to help treat acne, as well as the role of light-based therapies.
Let's do a rapid but not so rapid fire round, talking about some of the supplements from our integrative section that we use for our acne patients. Okay, I'll get it started. Vitamin D. Okay, vitamin D deficiency has already been detected at a much higher rate in patients who have acne compared to healthy controls. And therefore, one thought that occurs to me is topical vitamin D. Has that been used in treating acne? Is that a possibility? Well, they actually did use that. That hasn't been studied. They did a follow-up clinical study with vitamin D supplementation and noted that it improved inflammatory lesions in patients with the 25-hydroxy vitamin D deficiency. Then they used this topical vitamin D in an RCT to investigate in the form of like calcipotriol. And they compared it to adapalene and a placebo. So there were three arms here. And they clearly showed that there was an improvement in the post-treatment acne in the calcipotriol versus the placebo groups. And they used an interesting acne score that we don't use very popularly here, but it's called the Japanese acne grading system. Adapalene was still the most superior of the three, but calcipotriol definitely performed better than placebo. So, hey, it is there. It's right out there. And if you don't like adapalene and you still want to stick with something simpler, this is an option.
That's great. And I think along the same lines, when we go to screen our patients with acne who maybe have refractory acne, we might check their vitamin D levels and supplement accordingly. Something else that we check in these patients is their zinc level. So we know that zinc has anti inflammatory actions, it protects both your adaptive and your innate immunity. And it's also been pretty extensively studied in acne treatment. So overall, trends in clinical studies have found an increased efficacy of zinc in treating acne as compared to placebo. Another older study, but still of great value, 1989 clinical trial that showed zinc gluconate, just at low doses, so 200 milligrams a day, resulted in significantly reduced inflammatory scores compared to the placebo group. Something I would like to highlight here is that we are only supplementing zinc if the patients are deficient. And the reason is high dose zinc supplementation over time can actually lead to other problems, copper deficiency being one of them. Basically, copper and zinc do share an absorption pathway in the gut. They're kind of competing at the metallothionein level. And so you definitely have to make sure you're supplementing these in a very controlled and balanced way. We typically do zinc and copper testing at baseline. And then from there, if we need to supplement zinc, we'll do so in about an 8-to-1 ratio with that copper. So zinc at an 8-to-1 ratio.
So like for every 10 milligrams of zinc, you should supplement that 1 milligram of copper roughly. Yeah. And you know, when you say that, you're right, we should check it, right? So I know people, me myself personally, and then as we check a lot of people's blood work, that several people have a very high copper, whatever the reason may be. So in those people, you don't really need to supplement this extra copper. Zinc might be a treatment to bring that copper down a touch. Copper also in really high amounts can be neurodegenerative. So we don't want to just keep going with copper without knowing where copper was at baseline. So as you know, Natalie, that in our team, we always check zinc. Whenever you check zinc, we check copper as well for that reason, right? Next one I have for you is EGCG. Okay, so that's epigallocatechin gallet, which is a polyphenol in green tea. It's a really hard word to say. Slightly older study here for you, 2013, 8 weeks split phase. That's my favorite kind of study because you have the same person as the control. So one part of the phase, they apply the product, and the other part acts as control. So this was studied, and they showed that two different percentages actually of EGCG creams, 1% and 5%, they tested both in this. The sites that were being used with the actual product, with the green tea extract product, showed significant more improvement in both inflammatory and non-inflammatory acne lesions.
Yeah, Dr. C, black tea actually, believe it or not, can also be helpful in addition to all of the other acne regimen steps that we're doing, but especially as a compress. What we can do, we know black tea contains tannins, and these have really wonderful antioxidant, anti-inflammatory properties to help reduce redness and irritation, swelling. Interestingly, black tea also has mild astringent qualities too, so it can help to kind of tighten the skin, reduce excess oil, which we know are both contributing factors to the skin and inflammation and acne. So, when applying a cooled black tea compress to the skin, and there's a very specific way to do this, we are happy to provide more information on this if you're interested, but it can really help to calm that inflammation, support the skin's natural healing process without those drying effects of some harsher chemical treatments. It is really recommended as an adjunct, so it's not the end all be all, but it's something for a patient who maybe wants to do something a little bit more natural or gentle. It's actually been studied clinically. There was a trial in 2019 by White et al. Showed a significant reduction of disease severity as measured by 4 different disease activity scores in patients with atopic dermatitis. So it hasn't been formally studied for acne patients, but the patients that were studied had facial involvement of their atopic dermatitis and had really good improvement with just black tea compress alone.
Yeah, and I think in that study, Natalie, I think they have the description of how they prepared these black tea compresses. We often have a handout available for our patients in our clinic if they are interested in this. We tell them to follow it exactly to the word, and not to buy something that is not black tea. It should not be a flavored tea or a peppermint tea. That can be very bad for what we are trying to achieve here. Yeah, so niacinamide is my next one. It is a vitamin, as we know, belonging to the B3 family, and this is already found in the human body. It has many roles to play in the biochemical metabolic reactions, and has a role in anti-aging processes. It reduces DNA damage, oxidative stress, inflammation, all the good things, and therefore it also has a role in as a topical agent in treating acne. They sometimes they use the words nicotinamide and niacinamide interchangeably when we're talking about a study. So in this randomized controlled trial, 4% nicotinamide versus 1% clindamycin were compared for moderate inflammatory acne, and both the gels were quite comparable on these acne skin. But nicotinamide stood out because of its efficacy on oily skin. So when your oily skin patients are asking for how can I add that little boost of impact with reducing the oiliness, there's one for you.
That's wonderful, Dr. C. And I would like to highlight also as an option, we talked about all of these therapies that are at home options, but we also have some in office procedures that we can use for these patients, both with inflammatory acne lesions and also significant acne scarring. We will plan to bring an expert in for this eventually to chat all things lasers, but I would like to touch on a couple of options for our patients who, have inflammatory lesions that are maybe frustrating and refractory to those traditional topical therapies. Light based therapies are helpful. So we talk about blue red light. This is basically a broad spectrum continuous wave visible light source that helps to reduce inflammation. We have intense pulse light, photodynamic therapy, photopneumatic technology as well. Even superficial chemical peels can be helpful for those who have comedonal acne to speed up the process of the resolution of comedones. Microdermabrasion can be helpful, comedone extraction, and then some other lasers like a KTP laser, PDL, infrared lasers. We have so many different options.
We hope you enjoyed part 3 of our 4-part episode on integrative approaches to treating acne. Thank you for listening to The Blend. We'll see you back next time.